Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today, our focus is for our class 2021 PCS Coding for specifics related to respiratory and gastrointestinal and hepatobiliary systems. Our key points will be focusing on the different characters within the respiratory, which include respiratory procedures, as well as mouth and throat, and a quick look at the lungs and those body parts, and guidelines to the respiratory system. And then we'll flip over to our chapter on gastrointestinal and hepatobiliary systems, which include the gastrointestinal system, hepatobiliary, and pancreas, and specific coding guidelines. So let's get started. The first thing we want to talk about is that there's two different characters for respiratory system as well as the gastrointestinal. We'll start by looking at the respiratory system, and we can see that what may surprise you is that both the respiratory as well as the mouth and throat are going to be considered part of this system. You'll notice in your textbook when you look at the respiratory system, the first area codes to mouth and throat and includes things such as teeth, salival glands, tonsils, and various other procedures that can be done within the mouth and or the throat. The oral cavity and the voice box are both highly related to the respiratory system. You have a couple of really great anatomical graphs that are found in figures on your chapter 10, 1, 10, 2, 3, 4, and 5 in the first couple of pictures that you have, 5 being the trachea and lungs. The rest of the respiratory system starts with the trachea going into the lungs, and you have some really great details that identify the different lobes of the lungs within the respiratory system. Now it's important here that there's an anatomy alert to be aware within the respiratory system that when we talk about lungs and we talk about resection or excision, anytime there's an entire lobe that is removed, it is considered its own body part. This is especially important in both the respiratory and the liver because those lobes are going to be coded to a resection as opposed to an excision when you talk about what the body part was. You can see here the different lobes and identification of the lungs themselves, going from the superior lobe to the middle and interior lobe on both the right and left, and then the left not including a middle lobe, but only the superior and inferior lobes. When you're looking at other parts within the lungs, you'll also notice that we identify the differences between the bronchus and the bronchi and the bronchioles. So when you're looking at these, you'll want to make sure to identify exactly what was the procedure and where was it to. Some of the common root operations that you'll see, you have definitely biopsy because you will be seeing some tubular body parts within the respiratory system. It's important to identify anytime you have tubular body parts versus body parts that are not tubular, as you'll have different codes for the same types of procedures based off of the root operations. On page 203 of your textbook, you have some body parts identified for both the mouth and throat, as well as the respiratory system, that identifies each of those lobes, as well as each part within the respiratory system and all the different parts found within the mouth and throat that are going to code here. Now, some of the guidelines that you'll be identifying, guidelines B311A, B38, and B35A, which I've given you a brief introduction on the board. The first thing to be aware of is that for guideline B311A, don't code inspection if it's done as part of or as to confirm the main procedure that is being done. They've given us an example of a fiber optic bronchoscopy that is performed for irrigation of the bronchus. In this case, the irrigation of the bronchus would be the procedure, not the inspection that was done as part of that procedure. You'll see a lot of times with tubular body parts where we do inspection that is later converted to the primary procedure, and it's important not to code both of those, but rather just the main procedure that is done. Not to be confused with our guideline B38, which basically says here that, as we mentioned a moment ago, lobes of the lungs are complete body parts. And so for that reason, when you're looking at the different lobes, you want to make sure that you're coding for resection if an entire lobe is removed, as opposed to an excision of the lungs, because you want to identify that the lungs are not by themselves a body part, but a collection of many body parts according to PCS guidelines. Our section B53A guideline says to code approach at the external as external for any body part that you can grossly see. When you say grossly, we say what we can see with the eyes without any help from a tool. So if I were to open my mouth, the first thing you would see is my teeth, or perhaps my tongue, or other parts of the mucosa that's inside of my mouth. Depending on what the provider is doing, if they don't need to, if they can get to the actual body part without any additional tools, then that's going to be considered an external approach, as opposed to, say, an open approach or an approach percutaneous, or endoscopically even. So let's code together one of the cases that we have here in the respiratory system. We have our first example here, which gives us case number 1 on page 205. For the respiratory system, we have a tracheal dilation for laryngotracheal stenosis. The procedure is performed with a rigid bronchoscope. And the first thing we want to look at here is we have tracheal dilation for laryngotracheal stenosis, meaning that the larynx and the trachea are smaller than they should be, and so we want to open them up. And when we think about the root operation for that, the thing we should be thinking of is dilation. And so I'm going to come into my code book here, which I have the current recommended copy of the 2018 ICD-10 PCS Expert Edition published by Optum as my code book for this class. And I'm going to start, and remember that I'm always going to be within the medical and surgical section 0, and in this case, the trachea would be considered part of the respiratory system, not the mouth or the throat. And so I'm going to apply a character B as in boy. I may also remember that dilation for my root operations is 7, or I can look in the alphabetical section of my PCS codebook to determine dilation of the trachea in order to determine what 3 characters I would be looking at. I can start directly in table 0B7 to determine what my code would be. So I'm going to go to that now. I find myself under 0B in the respiratory system. And I find myself finding 0B7 on the top of page 322. Because it's on the top, I want to look before and after to make sure this is the only table before I get started. And so on the previous page, I see that the previous table is 0B5. And on 322, I see 0B7 at the top, followed by the table for 0B9. Because I've confirmed there are no other tables, I know that when I find my code, this is the only table it will be found within. I see here that I'm in the medical and surgical section for respiratory system, which is correct, that's where I should be, under dilation. And I can read the definition here that this is expanding on orifice or lumen of a tubular body part. I want to ask myself, is the trachea a tubular body part? Yes, it is, because there is a tube that goes down from the mouth into the lungs. Okay, the orifice can be natural orifice or artificially created, accomplished by stretching of a tubular body part using intraluminal pressure or by cutting part of the orifice or wall of the tubular body part. In this case, the dilation is used. It doesn't give us all the details in the example that it's given us, but we can read here that the root operation for this procedure is defined as expanding the orifice or lumen of a tubular body part. So if we were to look at the actual notes, it would give us further detail to say, yes, this is going to be expanded. The next thing I can do is look at my body part key. And I want to remember that the dilation is to the trachea, not the laryngo or the larynx. Because when I'm looking at this, I want to make sure I select the correct term. The trachea is listed as number 1, and so I'm going to list 1 as my next character. My approach is going to be looking at the differences between open, percutaneous, endoscopic, natural or artificial, opening, or natural or artificial endoscopic. Now in this case, this would be a time where you would need to look up the procedure and the details itself. And here, we do have the details identifying that a bronchoscope is used. And because this is a natural opening, I'm going to go with character for 8, natural or artificial opening endoscopically, because that bronchoscope is considered an endoscope, a scope that goes into the body. So my next character is 8. Last but not least, I have the differences between a device for an interluminal device or no device. When I come back to my original statement and additional information, there was no additional device information listed. And so I would put Z for no device. If I was uncertain about that, I could look it up online to say, what is specifically an interluminal device when doing a tracheal dilation? In that case, it would give me some details to identify whether or not this was in fact related to the bronchioscope that I am already using, or if it was something else. And last but not least, we have Z for our qualifier, as there's no option here. So I come down to my code as 0B718ZZ. I'll come now back to my book and see if this is accurate. When I look at the coding characters, the rationale says 0B718ZZ. So I know that my code is correct. The root operation dilation is coded to describe a stretching of the trachea. This is correct. We already identified that when we looked at dilation, but now they're giving us a little more detail as to how we came to that. The procedure is performed through a bronchioscope or approach value 8, natural or artificial opening, endoscopic, because the scope is an endoscopic instrument. We also knew that, and if we didn't, we could have done a Google search to identify what is a bronchioscope and identify exactly what that entailed and what it was. There's no device or qualifier for this code. Perfect, so we've already coded our first code for the respiratory system. Now we're ready to move on to our second topic for this week, which is gastrointestinal and hepatobiliary systems. Let's take a look at that chapter now. I find chapter 12 starting on page 251, and the first thing I identify is that there's 2 different characters for this body system, which are characters D for gastrointestinal and F for hepatobiliary and pancreas. In the digestive system, the organization always goes from top to bottom. So you want to think from mouth to anus, but excluding respiratory systems that are included under mouth and throat. So it's important to identify these when you're looking at which specifically you're identifying your procedures to, since these are in fact considered separate. You have some diagrams on figures 12.1, 2, and 3, which are really good. I think personally my favorite is 12.1, as it identifies all the different parts within the digestive system that are considered part of the GI system as part of PCS coding. You also have some breakdowns of the hepatobiliary system, which involve your liver, gallbladder, and pancreas, as well as the ducts going into each of these. Because these are considered a separate area, even though they're part of the GI system, you'll want to make sure that you identify which part of the GI that we're looking at in order to identify which particular body system you're going to list. Now the guidelines for this one are going to identify B31B and B32C, which basically say that all parts of a main procedure are included if necessary in order to perform that procedure. So it's basically like saying, if I remove a lesion from the arm, I'm not going to code an incision, the removal, and a suture or repair for that lesion removal. I'm just going to code the lesion removal. It's expected that whatever you do in order to get to the body part you're coding, your surgery is on, you're only coding for the main purpose of the procedure. If, however, there's additional procedures that are done that aren't necessary in order to do this particular procedure, those would be coded separately. And a guideline for B32C tells us that if there's different objectives or different problems that are being addressed at the same time, so long as they have a different root operation, they can both be coded together. Those are really important, especially in the GI system, because oftentimes you'll see multiple objectives and things identified that the provider may want to focus on. The provider could, of course, come back at a later time, but it doesn't make sense clinically or for the patient to do 2 different surgeries when they can do everything all at once. And for those reasons, we have to identify as coders how to make sure we get paid for all the procedures that were done as part of separate procedures, as well as identifying that there wasn't really much extra done in order for us to do something else. And that's really part of the main procedure we're getting paid for. You have the body parts identified on page 257 of your textbook for the different parts of the GI system, as well as specified areas that fall under the hepatobiliary system, which are technically part of your GI if you think about body systems in terms of medical training that you've had so far. However, keep in mind PCS identifies these separate, and it should always be identified by you as a coder based off of how PCS separates these. You have one more guideline in here, which is a couple more guidelines, which are for B5.2 and B3.6a that weren't listed on the board here. So I want to read those to you. For B5.2, procedures using an open approach with a percutaneous endoscopic assistance are always going to be coded as open. What this basically says is if you have to have both open and endoscopic percutaneous, open is going to be considered a much higher level of a procedure and has a higher reimbursement. For that reason, you'll code the higher of the two, not both, and not the lower. And B3.6a, for bypass procedures, coded by identifying the body part bypassed from, and the body part is bypassed to. The 4th character body part specifies the body part that was bypassed from, and the qualifier specifies the body part bypassed to. In other words, you're going to have 2 body parts in this example. The from should always be where we start, and the to should always be where we went to. And in this case, when we have a bypass procedure, we're going to have a qualifier specifically to that. You'll see that in this week's coding as you take some of the examples this week and apply those directly. Last but not least are procedures that are done to the perineum. And you have a figure on 12.5 on page 259 that shows you some of the different areas that are included here. And so sometimes you will have some of the procedures done within the gastrointestinal system that may in fact go into other areas. Keep in mind that anything that you're doing as part of that procedure, if it's necessary as part of that procedure, is all one procedure. But if there's multiple procedures with different objectives, those can be coded separately. In the hepatobiliary system, you have different devices and qualifiers, and those are listed in tables 12.3 on page 260. And in fact, we're ready to look at our first code here for this example. Let's look at case number 2 on page 261 for our procedure of a pancreas transplant. Now keep in mind, anything that's necessary to be done as part of this main objective is part of it. So we probably won't be coding for a removal of the previous pancreas, but rather just the introduction of the new pancreas. The procedure is performed using an open approach, and the native pancreas is not removed. In this case, we didn't remove it. The organ is from an unrelated matched donor. In this case, we're going to start by identifying our section as 0 for our medical and surgical, and we'll remember the root operation for this will be transplantation. Before we get there, we want to also look at the fact that transplantation is Y. We also want to look at the difference between GI and hepatobiliary systems. In this case, the pancreas is the organ that is identified, and based off of PCS organization, that falls under character F for hepatobiliary systems and pancreas. So my first 3 characters are going to be 0FY. If I wasn't sure about that, I can look at the beginning of my PCS codebook under transplantation. What are we transplanting? We're putting in a new pancreas. In this case, I can go directly to my table and start looking up the code now. So I'm going to go to 0FY. When I get there, I always want to verify, as I did earlier, that there's only one table or if there's multiple tables. And so I'm going to find my code, or my table, I'm sorry, on page 393 at the very bottom. Because it's at the bottom, I can see that the previous table is 0FW, and so I know that my table starts at the bottom of 393. And when I look on the next page, it's actually blank. So I know for a fact that my table for 0FY is only going to be one table. Keep in mind there will be times where there will not be only one table, and this is why we always want to verify that just in case there's something that varies that's different. Under 0FY, I see that I'm in the medical and surgical section for hepatobiliary systems and pancreas. I know that's correct. I have the definitions of a transplantation, which is putting in or on all or a portion of a living body part taken from another individual or animal to physically take the place and or function of all or a portion of a similar body part. So for this matter, I do know that transplantation is correct because the part that was put in is from another donor, not within the same body part or body system. And so transplantation is correct. My next character is going to be for the pancreas, which there's only two options. So the pancreas should be fairly simple to identify. The only approach allowed is 0 for open. And I can come back here and verify that that's accurate, that it was an open approach. But keep in mind, while you only have one option here, it's always good to verify. Because if for some reason you're in the wrong table, that's going to be a big trigger when you're looking at the differences in the type of procedure and how it was done. If you look and say, why do I only have one option? Next is the device, which there is no device for. And last is going to be our qualifier. And there are qualifiers for this. We should not use 0. We have the difference between allogenic, syngeneic, and zooplastic. And in this case, this was from someone else, or allo, for a donated match. Syngeneic would be if it was artificial, and zooplastic would be from another animal. In this case, I have my code here as 0FY G0Z0. And I'm going to confirm it now with my chapter book to see if this is correct. I have code characters for 0FY G0Z0. And so I do see that's correct. And in the rationale, it tells me the index provides 6 of the 7 characters as 0FY G0Z. Hey, we could have gone to the index to get that entire code without putting it together. There's different ways we can always code for this. And this is one reason where you may save time looking at the index, or it may become easier to look directly at the table. I myself prefer to go to the tables and look exactly at what I'm putting together. You may be a little different, and that's okay. So long as you always verify your coding in a table, it's okay if you look at different areas to put those together. The qualifier is 0. Allogenic is assigned because the organ was from a matched donor. The correct code assignment is 0FY G0Z0. Perfect. So we've now coded our first code in the hepatobiliary system that's included with the GI system. We've identified some of those guidelines, and we've looked at the different specifics within the respiratory, mouth and throat, gastrointestinal, hepatobiliary, and pancreas system. If you have any questions this week, feel free to send me an email or text on my cell phone for any urgent issues that need addressing. And until next time, we'll talk to you later.